Hi, welcome back to Dr. Oliver Daily. Unfortunately, we live in a time, and this is not just our time, but throughout all of history, where people are discriminated against, people have biases against others, people generate stereotypes against others. And this is true also with weight and obesity and overweight syndrome. It's unfortunate that people look at others and make determinations about them based on their size or their weight. And I'm here to set the record straight that obesity and overweight syndrome is a medical disorder, genetically based, biochemical, metabolic, hormonal, and psychologic. So we are not at fault with our excess body weight. However, we are responsible to get the proper treatment and get it under control for our own benefit. We should not discriminate or bias against people who have excess body weight because they are living with this disorder. Now, if you're thin and you have the genetics of a thin person and you can eat anything you want, you have a totally non-understanding of the overweight situation. And I tell you that because I've experienced that, where many of a spouse or a friend will come into my office with someone who struggles with weight problems and says, well, if they just eat less and get out and exercise more, they'd be okay. That is not correct. And I try to dispel that from everybody. So that is not correct. They need medical treatment. They need to be adjusting metabolism, possibly hormones, certainly psychologically. They need to have that addressed where they can strengthen their psychology and work on this. But it's a lifelong disease and it has to be worked on for the rest of life. So let's be careful when we stereotype people and just think that they have some responsibility problem. That is not true. Being overweight, being obese is not your fault, but to take care of it is your responsibility. Talk to you soon.